Hi, and welcome back to Sirenica TV. I'm here with
Martique.
Alrighty, and we're actually old friends. We've been on each other. How long have we been on each other now?
Over, I want to say a decade.
Yeah, 10 years.
Very long.
Long time. But we both wind up working in healthcare. I wind up working as a wound care specialist nurse for the last 5 years, almost 6 years now. Basically, wound care specialist, what we do is we take care of any kind of wounds that a patient may have, whether it's amputation, aftercare. We do all the aftercare after it's any kind of surgery, whether it's amputation or whether it's open wounds, pressure sores, or whatever. We have to clean it, dress it up, and then also we teach the patients and their loved ones, their family, how to take care of the wound after they're gone, after they've been discharged from the hospital or wherever and going back to their family. So we're going to go ahead, we're going to let you talk about what you've been doing in the healthcare field. And also thank you to all the nurses and doctors that's been taking care of everybody during the coronavirus pandemic. And we just take our hats off to you guys and ourselves, because we work in the medical field. Yes. And we work in the medical field as well, so we take our hats off to everyone that's been putting themselves on the front line, just because of this bad, terrible, disastrous disease, coronavirus pandemic that has hit our nation. Again, thank you for watching Sirenica TV, and we're going to listen to Marquise to see what he has to say.
Well, I wouldn't say I have much to say, because you probably have more experience than me. But I used to do the corporate side of the medical field, which is the back end revenue cycle, anything to do with medical coding and billing, checking patient accounts, and seeing who needs to pay for the patient account, copay, with insurance that needs to be responsible, or whether it's patient responsibility. Worked in the refund department. Now I'm doing registrations. I'm actually currently registering COVID patients, and there's a new program called HRSA, which pretty much provides funding for COVID patients to get the vaccines if their primary insurance doesn't cover that. And so that's what I'm doing currently. I'm actually in the transition of opening my own private home care business.
That's awesome.
Thank you. Where we work with special needs, elderly, disabled, vets, etc. And I'll be sending people out to basically different homes, personal care homes, home health, any person that would need any type of living assistance. I'll send aides out, and CNAs, caregivers, what have you. And so I'm actually in the middle of that transition to go from, I guess you could say, the corporate side to more of the entrepreneurial side of it. So right now I'm a work in progress, but I guess you could say I'm still catching up.
That sounds awesome. Thank you for watching, and Martique and I, we've been on each other for over 10 years, and we both went into the health field. Our journey went into the health field, and so we just kind of want to align some people on some of the stuff that we've been doing over the years in the health field, and also again just thanking everyone that's on the front line that's been helping out with the coronavirus pandemic, and just continue to keep yourself educated, wash your hands, make sure you keep your mask on, protect yourself. And if you feel like you're sick, go see a doctor right away. Don't just wait. And we still deal with patients, coronavirus patients every day. We have to protect ourselves because of that.
Right.
And you just have to just stay informed and, you know, just stay safe. That's all you can do till all this is all over with.
Absolutely.
Yes. So is there anything that you would like to add?
I would like to add something. I don't know if you want to call it personal or just insightful, helpful for people. That's how I feel. As far as your personal health, you know, especially during these times with the
Exactly.
pandemic. I feel like if anything, now is the time to pretty much improve, you know, just your way of living. You know, like your diet, what you eat, you know, exercising, trying to stay fit the best way you know how. Because I know we all have, you know, work schedules or you know, family, you know, things going on, and that you might have to, you know, work around. But definitely, you know, don't forget about yourself. Definitely take care of yourself. Don't neglect your, you know, your body, because, you know, this is the only body we get.
That's
you know,
right.
And that's it. So that should be one of, I think, the best investments. You know, because, you know, you can't do anything, you can't reach your goals, and, you know, become successful without a body. You know.
Exactly.
So yeah, that's the way I see it. Just make sure, you know, check up with yourself, and like I said, you know, try to. I know me personally, I kind of got a, you know, a sweet tooth, and you know, I like to kind of like cheat, I guess you could say, and but yeah, I think as long as you have a good balance, and you know, just do things in moderation.
That's exactly right, because, you know, like I always heard people say, like, you know, eating too many sweets or doing indulging too much of anything can cause really bad health problems. Like, you can have problems with your kidneys from not drinking enough water.
Right.
And drinking water, it actually helps you stay hydrated. It keep you from having fever, all kind of different stuff. You know, it just help protect the body and help to keep the body cool. But also, if you're eating a lot of sweets and things like that, you can wind up being a type 2 diabetic.
Right. Yep.
Type 1 diabetic, a lot of people are born with that. But type 2 diabetic is something you can control with diet. You know, just eating healthy, taking good care of yourself, you can control that. But, you know, but once, you know, diabetes enter your body, you know, it can be a process to try to get back on a healthy path. So it's very good to just take care of yourself and eat healthy and live a good, healthy life. Because like Martique said, you know, this is the only body we get, you know.
Yeah.
So we have to take care of it, you know.
Absolutely.
We really have to take care of it.
Especially during this time, because it's like, you know, COVID is just like really exposing people in their health condition, you know, with all the underlying conditions that people may have. It really just brings out the worst in people. So, you know, you want to just do everything you can to avoid that, you know, and you know, just increase, you know, your chances of survival, basically, and, you know, just living a healthy life. So, you know, it's pretty much the way I see it, you know, just trying to stay healthy, inside and out, you know, mentally as well.
Yes,
you know,
exactly.
You know, because, you know, stress, that can also affect you and manifest into your body.
Exactly.
And, you know, you just want to just try to erase all of the negativity, you know, in your life, you know, because, you know, like I said, you know, one body, one soul, one life to live. So
exactly,
that's it. There is no redo, no reset.
That's exactly right.
So, yeah, that's pretty much all I have to add to that.
Yes, and also another thing that people have to really be careful of is high blood pressure, hypertension. There's a silent killer. you could think you're doing fine and your pressure can be elevated. You may not even know it. So eating salty foods and eating spicy stuff and a lot of greasy foods can just add to that. And then also just having stress in your life, daily stress, or just paying bills, surviving, and taking care of your families and things like that. That can just be stress that you're not even really even aware of. But then if you're eating the wrong foods, that can add to it. So remember, having high blood pressure or hypertension, it is a silent killer. You don't know, you could just have a heart attack at any time, a stroke or aneurysm, it could be over with. Or you can, even if you survive, you might not be as healthy as you used to be. So just try your best to take care of yourself, eat healthy, and just live a good, healthy life. And thank you again for watching, and we love you all so very much.